Welcome to Visions Beyond. We're doing a deep dive today into something
Yeah.
that might actually surprise you.
Oh, yeah.
Yeah, the link between diabetes
Okay.
and a condition called Charcot foot.
Interesting.
Yeah, so we're pulling information from a bunch of different places. Medical journals, the American Academy of Orthopedic Surgeons.
The AAOS.
Exactly. And the Cleveland Clinic.
Wow. So we've got like a variety of
To
sources.
get into like the nitty gritty of this. And one of the things that I found super interesting is people with Charcot foot can have significant bone damage.
Significant bone
Yeah,
damage.
like fractures, dislocations,
Okay.
without feeling any pain.
That sounds kind of dangerous.
It is.
Yeah.
Wild stuff, right? But before we get into that, don't forget to like, share, and subscribe to Visions Beyond.
Yes, please do that.
Okay, let's get to it.
Let's do it.
So, first things first, what exactly is Charcot foot?
Yeah. What is that?
I'm picturing a pirate with a peg leg.
Yeah.
But I'm guessing that's not quite it.
It's peg. It's not a peg leg, no.
Whoa, what
But it does involve some pretty dramatic changes to the foot. Kind of like this. Think of your foot like a building.
Okay.
Right. And the bones are the support beams.
Uh-huh.
So in Charcot foot, it's like those beams that start to weaken and crumble.
Oh.
Almost like the foundation is giving way.
Whoa.
Yeah.
Okay, I can see how that would be a problem. So where does diabetes fit into all of that?
It's interesting because diabetes, it's not like a wrecking ball demolishing those support beams. It's more like the sneaky termite infestation.
Okay, a sneaky termite.
Yeah, sneaky termite. So basically when you have like long-term high blood sugar from diabetes, it can damage the nerves, especially in the feet.
Okay.
And this nerve damage, which is called neuropathy.
Right.
That's the primary reason that Charcot foot develops.
Because of neuropathy, people with diabetes might not feel pain when they injure their feet.
That's exactly right.
That is terrifying.
It is terrifying because even a seemingly minor injury, like if you stub your toe or get a small cut, you might not even notice it.
Wow.
And because you can't feel that pain, you continue to walk on that injured foot, putting all that stress on bones that are already weakened.
Too bad. Walking around on a broken foot without knowing it.
Yeah, pretty much.
Ouch.
Yeah, and that leads to more fractures, more dislocations.
Right.
And eventually, the foot can become really severely deformed.
Wow. Okay, so no pain equals big problem.
Big problem, yeah.
But what if someone with diabetes does notice something wrong with their foot? Like, what early signs should they be looking out for?
That's a great question. And it's important because pain, like we said, might not be a reliable indicator. So they need to be super vigilant about checking their feet. Look for any swelling, redness, unusual warmth. Even if it's just one foot, that feels warmer than the other. And any changes in the shape of the foot should be like a huge red flag.
So it's like being a foot detective, carefully examining for those clues. What happens if those early signs are missed, though?
Well, you're not going to get like a full-blown peg leg situation, but it can get pretty dramatic. Like if Charcot foot is left untreated, the arch of the foot can collapse.
Oh, wow.
Giving it this like rocker bottom appearance. The toes can curl under like claws.
And the ankle can become deformed as well.
Wow. And this is what the AAOS calls a Charcot joint.
They call it a Charcot joint, yes.
Okay.
And perhaps the most frightening complication, the development of foot ulcers.
Foot ulcers. Those sound pretty serious.
They are serious because you have these deformities and this loss of sensation. So ulcers can form really easily, like from unnoticed injuries or pressure points. And these ulcers can get infected, which in some cases can lead to amputation.
Wow. That's scary stuff. It really highlights how important early intervention is.
Absolutely.
We know that diabetes is like the main culprit here.
Right. But are there any other accomplices that might make someone more susceptible to Charcot foot?
Definitely. So diabetes is like the ringleader, but obesity and age can also play a role because when you have increased weight, that puts more stress on the feet.
Right.
And then naturally our bones weaken as we age.
Right. So it's like a recipe for disaster, unfortunately. This brings up another question. Can Charcot foot be mistaken for other conditions? Because I imagine it could be tricky to identify especially in those early stages.
You are right. It can be very challenging to diagnose because it can mimic other conditions like gout or arthritis.
Wow, okay.
So it's really important for anyone with diabetes to have regular foot exams by a healthcare provider. They can do a thorough examination, and they might even order imaging tests like x-rays or MRIs to confirm the diagnosis.
So it's not always a straightforward diagnosis?
It's not all.
Okay. This is a seriously important information, and I think it's a good place to pause. Let our listeners digest everything we've covered so far. We'll be back in just a moment with part 2.
To discuss treatment options and dive into some cutting-edge research. Don't go anywhere.
Welcome back. I hope you're ready for more on Charcot foot.
Absolutely, I'm ready. I'm curious, though. Yeah. Can even medical professionals miss this condition?
You know, it's true. Diagnosing Charcot foot can be tricky. It's kind of like solving a mystery.
Okay.
Especially in those early stages. You know when the symptoms are subtle?
Yeah, so.
Easily mistaken for something else.
Right, and the American Academy of Orthopedic Surgeons?
The AAOS.
The AAOS, yeah. I mentioned the early signs, like the swelling, redness, warmth. Those could even be confused with an infection. So how do you tell the difference? Especially when pain isn't a reliable indicator.
Right. Well, that's where a keen eye and some clever techniques come in. One thing doctors might do is they might elevate the foot for a few minutes.
Just to see how the swelling and the redness, the warmth, how they react.
Okay.
If it's Charcot, these signs should start to improve.
Okay.
But if it's an infection, they're less likely to change.
So it's like a mini experiment.
It is a mini experiment.
Right there in the doctor's office.
Exactly.
What other tools do doctors have to crack this Charcot code?
Well, imaging tests, those are really crucial. So like x-rays, those can reveal fractures or dislocations, even in those early stages when they might not be obvious just by looking at the foot.
So technology can help us see what's happening beneath the surface.
Right, exactly. It gives you that inside view.
Okay. And I remember the AAOS mentioned CT scans for surgical planning.
CT scans, those are amazing because they create really detailed 3D images of the bones.
Wow.
Which is incredibly helpful for surgeons, if they need to.
Correct.
Deformity.
It's having a roadmap of the foot.
Exactly. It's like a roadmap guiding the surgeon through all the intricacies of the foot.
Fascinating. Are there any other imaging techniques used?
Absolutely. So like MRIs, ultrasounds, those can be really valuable as well, especially when there's a suspicion of infection. Because remember, those imaging techniques, they're better at visualizing soft tissues where infections often hide.
Okay, that makes sense. I imagine it can be tricky to differentiate between the natural inflammation that comes with Charcot foot and
an actual infection. It is. Sometimes it's like trying to find a needle in a haystack. But MRIs, they can really help pinpoint those pockets of infection, abscesses, that might be lurking in those soft tissues. And sometimes doctors might even use bone scans or indium scans to check for a bone infection, which can be really difficult to distinguish from Charcot foot on regular imaging.
Wow, it's incredible how technology can reveal these hidden details.
Is it?
Okay, let's shift gears a little bit.
Yeah.
And talk about treatment options. We touched on conservative approaches like casting and bracing. But the AAOS really emphasized the importance of custom footwear.
Yeah.
Why is that so crucial, especially for someone with Charcot foot?
Well, think about it. Trying to fit a deformed foot into a regular shoe. It'd be like trying to cram a square peg into a round hole. It wouldn't work. And it could actually cause further damage.
Regular shoes wouldn't provide the right support or pressure distribution. So it's not as simple as just buying a pair of diabetic shoes.
From the store.
Sometimes, over the counter, diabetic shoes are enough. But sometimes people with Charcot foot, they need custom-made shoes. Specialized inserts called orthotics. These are designed to really support the foot, distribute pressure evenly, and minimize the risk of ulcers.
It's like creating a perfectly tailored suit, but for the foot.
What happens when conservative treatments aren't enough? I know the AAOS discussed some pretty intense surgical procedures.
Yeah.
For Charcot foot.
Yeah, unfortunately. Sometimes surgery becomes necessary when the deformities are severe or, conservative treatments haven't worked, or when there's a high risk of ulcers developing.
So it's kind of like a last resort.
It is a last
when things have reached a critical point. What kinds of procedures are we talking about here?
Well, the AOS outlined a whole range of procedures, and they often use a combination of them to address, the unique needs of each patient.
Right.
It's not a one-size-fits-all approach, so they might perform debridement to remove infected tissue from ulcers. They might lengthen the calf muscle or the Achilles tendon to improve flexibility. They might even remove bony prominences that are causing pressure sores.
It's amazing how surgeons can essentially remodel the foot.
It's amazing.
And from what I remember, the AAOS mentioned a procedure called arthrodesis.
Yes, you're right. Arthrodesis, that's where they fuse bones together to stabilize a joint. And correct. Those severe dislocations, that can happen with Charcot foot.
Right.
And they might use plates, screws, rods to hold the bones in place while they heal.
Wow, it's like they're rebuilding the foot from the inside out.
Pretty much, yeah.
But I can only imagine the recovery from these surgeries is pretty challenging, especially for someone with diabetes.
It is. Recovery is a critical phase, and it requires a lot of patience. The AOS stressed that. No weight bearing is allowed for at least 3 months after surgery.
3 months.
At least.
Wow, that must be tough, having to rely on crutches or a wheelchair for that long.
It is. It's a significant lifestyle change, but it's absolutely essential for proper healing. Because if you put weight on the foot,
too soon,
it can lead to
complications, right?
Like slow healing, new fractures, even the return of those deformities.
So it's a delicate dance between wanting to get back on your feet
and ensuring that the foot has enough time to heal properly.
Right.
I imagine there are also risks associated with these surgeries.
And AAOS was very upfront about those risks. They pointed out that the risk of complications with Charcot surgery is higher than with foot team.
What kind of complications are we talking about?
Wound healing complications, infections. Those are definitely concerns. And in some cases, there's even a risk of
amputation.
It's a serious reality that needs to be
carefully consider. Heavy stuff. But I remember reading that sometimes. The risk of doing nothing is greater than the risk of surgery.
That's a great point, and it's important to remember that untreated Charcot foot can lead to severe deformities, ulcers that just won't heal, and a much higher risk of amputation down the line.
Surgery is a big decision.
With potential risks, it can actually be a lifesaver for many people.
Exactly, and the AAOS highlighted that. If surgery is done before an ulcer develops, the success rates are quite encouraging. But of course, ulcers make things much more complicated.
Increase the risk of infection.
Exactly. And remember, infections in the diabetic foot are notoriously difficult to treat.
Right.
That's why preventing ulcers in the first place is so important.
It all comes back to early intervention and being proactive. Of foot care.
Yes.
Now I'm curious about those. Fascinating. Research insights we touched on earlier. We haven't really talked much about that World Journal of Diabetes article. Yes.
Oh, yes, that article delves into some really fascinating territory. It's packed with information about the underlying mechanisms of Charcot foot. I think we need to dedicate a whole segment to unpacking those findings.
I agree. We've covered a lot of ground already. From
loss, those subtle early signs, to the intricacies of surgery. So let's take a short break. Come back to explore the latest research. Don't forget to like, share, and subscribe to Visions Beyond. We'll be back shortly with part 3.
Welcome back to the Deep Dive. We've learned so much about Charcot foot, from the early signs to the treatments and even the surgeries. But I'm excited to get into this cutting-edge research. They're giving us a whole new understanding of this condition.
It really is, and that World Journal of Diabetes article has some really intriguing insights.
I'm still curious about those advanced glycation and products, the AGEs.
The AGEs.
Yeah, they sound like something out of the sci-fi movie.
Well, they kind of are. Considering the havoc they can wreak in the body, you got to remember, AGEs are harmful compounds that form when
blood sugar.
Right, so they're a major player in diabetes.
So they're like these tiny troublemakers that you accumulate in the body over time.
Exactly.
But their connection to Charcot foot specifically.
Well, that's where it gets really interesting. The research suggests that AGEs might actually play a significant role in the development of Charcot foot because they can build up in tissues, especially those with low turnover, like the bones in our feet.
So they're not just AG floating around aimlessly. They're actually targeting specific areas. What happens when they build up in the bones of the feet?
Think of it this way. AGs can stiffen tissues. They impair blood flow. And they can even trigger inflammation, all of which can weaken the bones, starts to make them more susceptible to damage.
So it's not just the nerve damage from diabetes. That's the problem.
These AGEs are also contributing to the destruction in the feet.
Exactly. It's like a double whammy for people with diabetes.
Wow.
And the article also discussed this fascinating receptor called RAGE.
RAGE, like not...
And somatic.
Not that kind of RAGE, no. RAGE stands for Receptor for Advanced Glycation End Products.
Okay.
So basically it's...
like a doorway.
On our cells. That AGs can attach to.
Right. So the AGs are like... these unwelcome guests.
Yes.
Trying to barge into the cells.
Yes.
And the RAGE receptors are the entry points. What happens once the AGs bind to those RAGE receptors?
Well, that's when things get really interesting and a little complicated because when AGs bind to RAGE, they trigger a whole cascade of events inside the cell, including inflammation and even bone breakdown.
So it's like a domino effect. One thing leads to another, and eventually it contributes to
the development
of Charcot foot. But the article also mentioned that people with Charcot foot tend to have lower levels of circulating RAGE. Wouldn't that be a good thing?
You would think so, right?
Yeah.
Fewer entry points for the AGEs, but it turns out that having enough RAGE might actually be protective because it helps.
Clear those pesky AGs from the body.
Hold on, so having more of these RAGE receptors could actually be
a good thing.
It is. Think of it like this. RAGE acts like a garbage truck.
Okay.
That picks up the AGs and takes them away. But when there aren't enough garbage trucks, that AGs start to pile up and cause trouble.
Oh, that makes sense. So it's all about balance.
Balanced,
You need enough RAGE to keep those AGs in check.
Right.
Okay. Fascinating. The article also went into detail about the role of inflammation in Charcot foot.
Yeah.
Why is inflammation such a big deal in this condition?
This was the body's natural response to
injury.
Infection.
Right. But in Charcot foot, it's like the inflammatory response goes into overdrive.
Yeah.
And it sticks around longer than it should.
So it's like the body's alarm system is stuck on the position, even when there's no immediate danger.
Exactly. And this chronic inflammation.
Yeah.
Especially in the bones of the feet, can actually contribute to bone breakdown and deformities we talked about.
So it's not just a one-time injury that causes the problem, but this ongoing inflammation is also fueling the fire, driving this excessive inflammatory response. Well, the article pointed to those pro-inflammatory cytokines. Remember those?
The cytokines.
Yeah.
Okay, back up a second. What are cytokines?
They're tiny proteins that act like communication signals between cells.
Okay.
And in Charcot foot, certain pro-inflammatory cytokines are present in higher levels, which basically tells the body to ramp up the inflammation.
So the cytokines are like the hype men of inflammation, getting the party started and keeping it going.
Yes, a perfect analogy.
Yeah.
And to make matters worse, the researchers found that certain immune cells, particularly those called monocytes, those are more prone to inflammation in people with Charcot foot.
So it's like their immune systems are already primed for battle. Ready to unleash inflammatory attack at the slightest provocation.
Right. And to add another layer of complexity, they found evidence suggesting that these monocytes are more resistant to apoptosis.
Apoptosis, remind me what that is.
So apoptosis is programmed cell death. It's a natural process where old or damaged cells self-destruct to make room for new, healthy ones.
All right. So in Charcot foot, these monocytes are like the guests who overstay. They're welcome at a party, refusing to leave when it's over.
They just won't leave. And because they're not dying off,
as they should.
These persistent inflammatory cells can continue to contribute to the damage
in the foot.
It's like a vicious cycle. The inflammation feeds the bone breakdown.
And the bone breakdown fuels more inflammation. Is there anything that can break this cycle?
Well, that's what researchers are working hard to figure out.
Okay.
And the article also touched on the potential role
of genetics
in Charcot foot. They found that certain gene variations might make some individuals more susceptible to developing this condition.
So it's possible that some people might be genetically predisposed to Charcot foot, even if they manage their diabetes well.
That's what the research suggests. But it's still an area that needs more investigation. You know it's not a simple case of you have this gene, you'll get Charcot foot. It's more likely complex interplay of genetic and environmental factors.
It's like having a loaded gun doesn't mean it'll automatically fire. Something has to pull the trigger.
Exactly. But overall, these research findings are really exciting because they're helping us understand the root causes of Charcot foot on a much deeper level, which paves the way for new and innovative treatments.
It's like we're peeling back the layers of the onion, getting closer to the core of the problem. What kind of treatments could these discoveries lead to?
Imagine being able to block those harmful AGs from binding to cells or developing therapies that dampen that excessive inflammatory response. Or even using genetic testing to identify individuals at high risk so we can intervene earlier and prevent Charcot foot from developing in the first place.
That would be incredible.
Wouldn't it?
It's like we have this precision toolkit instead of a sledgehammer to address this condition.
Exactly. And Charcot 3, the research is advancing at a rapid pace. So I'm optimistic that we'll see these breakthroughs in the
not too distant future.
This has been an amazing deep dive. We've learned so much about the link between diabetes and Charcot foot.
It really has. And it's information that could potentially save limbs and even lives.
Absolutely. So thank you to everyone for joining us on this journey of knowledge.
Yes, thank you.
And don't forget to like, share, and subscribe to Visions Beyond
for more fascinating deep dives into the world of science and health. Until next time, stay curious and stay informed.